Dr. Sudhir Reddy. I'm an orthopedic surgeon with 30 years of experience. I trained in some of the best institutes in India and the world and worked in some of the developed countries in the world. So, my main area of practice is osteoarthritis of knee wear and tear of the knee. That is what I treat every day. So, I am a qualified person to talk about this. Why am I doing this video? So you would have come across now about several advertisements, several probably WhatsApps, YouTube messages saying that there are new treatments, new injections that have been found called PRP or plasma therapy, which are miracle drugs, which when you take those injections, your cartilage will grow back and you will avoid surgery. You would have heard this several times. You would have seen this because I see every day so many patients coming to me. Some of them have received this injection, some of them are contemplating, so they keep asking me. So whenever we see this, we actually see we're actually so pained by this. We're outraged by this kind of advertisement because that is not the truth. So I want to clarify the role of PRP. What exactly is PRP? PRP is platelet-rich plasma. So some people even modified this because they are so smart that using PRP name, everybody is using it. I want to use some other name. So they've modified the name as plasma therapy. This is all fraud. So our body normally has platelets. Every ml of blood, we have about 1.5 lakh to 4 lakh platelets in every ml of our blood. Okay? So we have 6 liters of blood. So these platelets normally flow to every part of the body. We have a very, very efficient circulatory system. Wherever the platelets are needed, all the platelets in the body will go to that place and will give their services. So platelets have some secretory factors called platelet-derived growth factors. So there is a theory that wherever there is some damage, if these growth factors are given there, or if these platelets reach there, they will secrete these growth factors and they can help repair that process, which normally the body does. So some people have postulated that you take platelets with 10 ml of blood from here, segregate some platelets from there and then inject into knee joint or some other joint, and they will act there and they will grow cartilage. This doesn't stand scientific logic because you don't need platelets of 10 ml of blood. You have platelets from 6 liters of your own blood, which will naturally go to the damaged part, and whatever job they can do, they will do that. So this is 600 times more platelets than what you get from 10 ml of blood. This PRP has been around for last 30 to 40 years. Nobody has found it recently. Some people are claiming that they have found a new method. So this is all false. So this is being used in many areas, and there is some evidence that in some areas like tendons where blood circulation is low, when these injections are given, there may be some benefit. That's benefit of doubt. So sometimes if you give in some tendinopathy, it may be okay. But into joints, there is no evidence. Okay, and this is not a new process. So many people, so many doctors have used it for the last 30-40 years, and because there's not a promising results, the results are not good enough, many people have abandoned it. But every now and then some people will come, some people will believe in it, some people will promote it. Again, people's opinions change. But the worry this time and the fear this time is some people who, a lot of them are not related to arthritis, have no knowledge about arthritis, have no professional qualification to treat arthritis of the knee, for whatever reason, whether they are not able to succeed in their own area of specialization, they have started this scam that they have found new injections, and these injections, when given, cartilage will grow back and you will be able to save yourselves from surgery. Naturally, no patient likes surgery. Of course, surgery is an expensive process, painful process. Sometimes things can go wrong. Some things can go wrong, horribly wrong also. So no one will like surgery. Even surgeons do not advise surgery unnecessarily. Surgery is only required when everything else fails, when there is no other alternative, and that too after understanding all the risks and all the benefits, then only you should willingly, if you accept, if you understand everything, then go for surgery. And in right patients, for right indications, surgery performs very well most of the time. Okay? But it is not to be taken lightly. So no one likes surgery, everyone is fearful of surgery. So exploiting this fear and this dislike and this worry, these people have started this scam promoting these injections. So normally PRP is given by many people for the last so many years, and it is given for 5,000 rupees, 10,000 rupees, 15,000, 20,000, like that. So these people have now, on an industrial level, these people are advertising in newspapers, in paid media, in paid slots on TVs. They are going again and again promoting this scam, this fraud, and promising false results using digital media, WhatsApp, YouTube, bombarding the society with these messages, so that so many people, innocent people, people without medical knowledge, of course medical knowledge is very difficult to get. Most of the common public do not have enough insight into this. So many people are getting carried away by this, they are believing this, and they are actually selling their properties, taking loans, taking a lot of financial hardship, and giving these people 2-3 lakhs of rupees for these injections which have no benefit at all. This is the biggest medical scam today. This is the responsibility of all of us to expose this scam. What most of them do is, a lot of these PRP injections, they also mix with steroid. Steroid is a proven medicine to reduce pain when injected into the knee. So when you give this injection, you may get some pain relief. 1 month, 2 months, 3 months, 6 months, you may get some relief. So people are believing that these injections are actually working. But they also get to sign a consent saying that in many people this may not work. So we are aware of these risks. You sign a consent without you realizing. So if you go back to them and say that it didn't work, they will tell you that, oh, it is likely to work, take one more injection. Or if you finally question that it didn't work, then they'll say that for the vast majority of people it has worked. You are the only person it didn't work. So people are also not able to counter this, and they're accepting that it didn't work for them. So that is how this scam is spreading, and more people are falling victims to this. Another tricks what they do is, whether we have arthritis or whether we have wear and tear in the knee, how do we identify this? This is identified on X-ray. I have 30 years of experience. My main job is diagnosing and treating arthritis. I use X-ray. Every correct professional, every right professional, every knowledgeable person uses X-ray to see whether you have arthritis or not, because in X-ray, if you see gap, that means cartilage is there in the joint. If the gap is reducing, cartilage is wearing off. If the gap is completely obliterated, it means cartilage is completely gone. So, but if X-ray is there, you can also see. Patient can also see. Patient also can realize whether there is wear and tear, and can also realize whether with those injections, whether the cartilage has improved or not. So, to make you blind, to confuse you, they do something called an ultrasound. I cannot, with 30 years of my experience, I cannot read this ultrasound. I cannot understand this ultrasound of the knee. No orthopedic surgeon, I think, in my opinion, understands or needs to do this ultrasound of the knee. It makes no sense at all to do an ultrasound. So they do this ultrasound, and the ultrasound, it shows so many lines, so many shades, no one understands anything. They'll show you some lines and say that this cartilage is gone. And then 6 months later, they will do another ultrasound and show you another line, say that your cartilage has come back. They will not listen to your pain, whether your pain has improved or not. Oh, this ultrasound shows your cartilage has come back. This is a scam and fraud, so that you yourself cannot identify this.
We're going to look at the literature. We're going to look for the actual proof whether PRP is actually a miracle treatment or it's actually scam. We have to look at the proof. We will analyze the proof that is present in the literature. But it's also important to recognize what is the credibility of this proof. Literature is like a sea, as everybody can write anything, and vested interest can publish anything, write anything, and they may show that to support their own claims, because there will be lots of users of this PRP, and lots of users will keep on promoting that it works and will keep on publishing something saying that it works. But you have to look at the credible proof that is available in the literature. So one of the most respected publication in orthopedics or joint disorders or arthritis is called the Bone and Joint Journal. This is like a Bible for orthopedic surgeons, a Bible for knee disorders, a Bible for arthritis treatment. The quality of the literature that is published in this journal is the highest. Everybody would aspire to publish in this, and then only will try for the others, because the quality control is stringent, and what is published in this journal you can rely on that. So the title of this publication is The Effectiveness of Leukocyte-Poor Platelet-Rich Plasma, PRP injections on symptomatic early osteoarthritis of the knee, the peak randomized control trial. So what it actually means, randomized control trial, means this is a trial that is done with the highest quality, where you can see this is a double-blinded, randomized, placebo-controlled trial. That means the patient does not know, and the researcher does not know what was given to the patient. There was a placebo control. Some patients were given normal saline injection into the knee. Some patients were given PRP injections into the knee. The patient does not know what injection was given, and the doctor or researcher asking the patient, eliciting the results, also does not know what was given. So this is done to remove any bias in reporting. You can see in this study that the conclusion is there is no evidence that single or multiple PRP injections have any additional beneficial element compared to saline injections up to 12 months follow-up after treatment of early stage symptomatic osteoarthritis of the knee. So what it clearly says is a patient receiving just a normal saline or a PRP injection into the knee has no difference in the results. So there is no additional benefit at all by receiving the PRP injection. So that is the actual truth. And this is a recently published and most authentic and most rigidly controlled trial. So you have to trust this. So there are several other publications. This is JAMA, Journal of American Academy of Medical Association. This is again effect of intra-articular PRP versus placebo. Placebo means a normal saline which does not have any effect on pain and medial tibial cartilage volume in patients with knee osteoarthritis. It is again a randomized clinical trial. Again, you can see among the patients with symptomatic mild to moderate radiographic osteoarthritis, intra-articular injection of PRP compared with injection of placebo did not result in a significant difference in symptomatic or joint structure. These findings do not support the use of PRP for the management of osteoarthritis. Again, another repeated journal, another randomized trial, controlled trial, which shows that there is no difference in either pain or cartilage thickening. You remember, a lot of these people who give PRP will do some ultrasound, which no one in the world can understand, and then try to show you that the cartilage has improved. That is a false. It is a systematic review. Systematic review means they analyze all the good quality literature published in the recent past, and then they look at which of these injections. There are 3 injections: intra-articular hyaluronic acid, corticosteroid, and platelet-rich plasma. Which of these injections have any effect on the osteoarthritis. So Available studies provide recommendation, available guidelines provide recommendation of treatment. So general guidance from perspective, global perspective concluded that intra-articular corticosteroid or intra-articular hyaluronic acid are favored for different needed responses and can be utilized within the treatment paradigm. While PRP currently has insufficient evidence to make any recommendation, that means a steroid injection is already has some proof and some is somewhat helpful. Intra-articular hyaluronic acid is somewhat helpful, but PRP has no evidence that it is useful. Again, another trial, another PRP flop. This is again another randomized placebo-controlled trial, failed to demonstrate benefit. So we'll show you the conclusion. Again, so patient receiving intra-articular PRP injections got essentially the same degree of pain relief as those receiving saline injections. That means you give anything or do not give anything, it is no benefit at all. So PRP injections have no benefit. They also check the radiographic analysis. You remember all these surgeons, all these people who give injections will tell you that the cartilage has increased. So medial tibial cartilage volume actually declined by 1.4% with PRP compared with 1.2% decline with placebo. So it is actually worse than giving nothing. So you have to be very, very careful when you take this injection. So this is again the statement itself shows, the title itself shows, no benefit to platelet-rich plasma over placebo injections in hemophilic B. Again, another clinical orthopedics and related research, again, very, very, very reputed journal, untrustworthy journal. So this is American Academy of Orthopedic Surgeons, American Academy of Orthopedic Surgeon, very reputed organization, which gives guidelines after thoroughly analyzing everything, which the entire world follows. Platelet-rich plasma for knee osteoarthritis, technology over. And their summary finding, PRP was not found to have any significant effect on cartilage thickening using ultrasound or knee strength. So again, absolutely no positive effect at all. One more, you would have seen some, influencers, all sorts of people saying that they had ligament tear, or their family member had ligament tear, and then they received the PRP injection and they worked as miracles. So really, do we need to learn from these influencers about medical treatments? So these are the literature. Platelet-rich plasma injection for acute Achilles tendon rupture, 2-year follow-up, randomized placebo-controlled trial. Again, very, very trustworthy. Conclusion, PRP injection did not improve patient-reported function or quality of life 2 years after Achilles tendon rupture compared with placebo. So when you look at literature, it is clear whether PRP is a medical treatment or scam. It's up to you to conclude, but don't fall for these scams. The injections are actually harmful to you, will damage your cartilage, and then you may regret later. When you ask these people, they will tell you that they have worked for 90% of people. For 5 to 10% of people, they did not work. But essentially, everybody seems to be in the same 5 to 10%. It doesn't work for anybody. They keep on telling this because it is very difficult to verify and compare with others. Most patients keep believing it, keep falling for these traps. Also, they will get you sign a consent form, a lengthy consent form, in small print saying that treatment may not benefit you. They will tell you that the treatment is very beneficial, it will work very well, but in the written statement, they will clearly say that treatment may not benefit at all, may actually cause some complications, and you will sign that unknowingly. So if you eventually go back and question, they will show that you have signed a written consent after reading it. So you have accepted the risk, you know the risk, which you may or may not be aware. So this is how people are misled into this treatment and ripped off their hard-earned money. So I suggest you be careful with these. Don't trust this kind of advertisement, and also please spread this to your near and dear and other people so that people don't fall victim to these scams. Thank you.
The other thing, how is PRP procedure done? It's a very simple outpatient procedure. So I will show you the procedure in the video. So I'm going to explain how PRP is done. So we'll start with the taking sample first. It is a very simple procedure. It is done as an outpatient procedure in outpatients, in the consultation room usually, or a dressing room or an injection room. It does not need to be done in theater. It does not need too much of a setup, and it does not involve a lot of expenses. So we'll show you how it is taken. This is a sample that we have taken. Okay. So this is called centrifuge. It is a simple machine that is available in every laboratory. So we're going to keep this sample here. Okay. So we're going to keep two samples because it needs a counterweight. Okay. So it is kept in this here, and then close. This clear part here, this clear fluid, is now called platelet-rich plasma. That is the plasma containing platelets in this part. So this part we will aspirate with a needle. We'll aspirate with a syringe, and that is what is injected into the patient's knee. So this is platelet-rich plasma. That procedure is as simple as this. This clear fluid is platelet-rich plasma. We have taken two samples so that, okay, this is an adequate quantity. And now the platelet-rich plasma is in the syringe. So the knee area is cleaned with so that injection is given under sterile technique. So this is how the platelet-rich plasma is injected into your knee. That's it. So your knee can move a few times. Of course, under strict aseptic condition in the outpatient, and patient can immediately walk out after the stress. But this is quite simple. So how do you pay more money, or to be able to charge more? This is showcased as if this is a major procedure. You know, you will be taken to theater. There'll be a lot of cleanings. There'll be a lot of screens that are put. A lot of colorful lights will be lit, and then some music is played, and then they'll take blood, and then they'll make you wait in theater for 1 hour. This is processed. Wait for another half an hour, and then you come back again. You're blinded. Screen has been put, and then this injection is given, and then you're put in ICU or observation room for a few hours. And so the whole thing is made to look like it's a big procedure so that you can be charged more. Most of the knowledgeable persons or the proper professionals who use this, they probably charge you 10,000, 20,000 like that. But these people who have no relation, no knowledge, are not qualified, charge you 2 lakhs, 3 lakhs for these injections. I see so many of these patients have actually taken loans, sold their lands in the hope that their mother or their wife or their family members will get benefit of this and will probably save surgery, and they go to these places, give these 2-3 lakhs, get these injections, and then their knees, actually many of these knees get destroyed, they develop infections, they end up with multiple surgeries and sometimes losing the limb also. No injections should be given into the knee lightly, except in some certain situations, because every injection may cause some damage. The other trick they show you is that the knee has a lot of fluid. It has to be taken out. No, not every fluid in the knee is to be taken out. Arthritis many times causes fluid in the knee. It is a protective mechanism. The body secretes fluid. Of course, if you have a doubt whether it's an infection or some gout, you want to take out for a diagnosis, yes. Or if patient has a lot of pain, to relieve pain, yes. But you need not take out this fluid every time. So they should do an ultrasound to show there is a fluid as if only ultrasound shows the fluid. You can make out this fluid. It do not require an ultrasound at all. So this is a scam that is being perpetuated by few people who may or may not be qualified to treat arthritis at all, may not be qualified to have the knowledge to treat arthritis, but making false promise that this cures arthritis or grows the cartilage, and then looting innocent people and public with this scam. As a doctor, my responsibility, my loyalty is not to my colleagues or to my hospital. My loyalty and responsibility is to the society and the patients at large. So it is my responsibility to bring this knowledge to you, and I also request you, it's also your responsibility as a medically aware person, as a person with some knowledge, to spread this so that your family members, your near and dear, or general public at large can save themselves from this scam. Please spread this to at least 10 people so that few more people can be saved from this scam. Thank you very much.